Hi, everyone. Welcome to the USC Institute on Inequalities and Global Health virtual lecture series. I'm Sofia Gruskin, and as director of the Institute, it's my great pleasure to welcome you to this incredibly exciting event. We're calling it From the Global to the Local: Public Health, Poverty Alleviation, Gender Equality, and Social Justice. And this event is part of our lecture series that's intended to help us all understand and address health inequalities here in Los Angeles and around the world. And I frankly could not be more excited by this event, nor think of anyone better placed with whom to have this conversation. And when I say conversation, I actually mean conversation, as one of the exciting things is that Dr. Gayle has asked that we run this actually as a conversation rather than as a lecture. And it feels like we have so much to learn from the work that Dr. Gayle has done in Chicago, but also around the world to address the health of vulnerable communities. So I think it's going to be really exciting. So before we start, I thought it would be important to give a brief but important background to our distinguished speaker, or should I say conversant, right? Dr. Gayle attended Barnard College at Columbia. She graduated with honors in the BA in psychology. She earned an MD at the University of Pennsylvania School of Medicine and an MPH at Hopkins, and she's board certified in pediatrics. And beginning in 1984, she spent 20 years with the CDC, where she focused on global health and infectious disease prevention and control, HIV, especially HIV. And then she served as the AIDS coordinator and chief of the HIV division at USAID, which is, I think, only the first time that we connected, I think. And then in 1995, she was appointed the first director of the newly created National Center on HIV, TB, and STD Prevention. And she was named an Assistant Surgeon General and Rear Admiral in the US Public Health Service. She also directed the HIV, TB, and Reproductive Health Program at the Gates Foundation for 5 years. And then for more than 10 years, she was president and CEO of CARE, that international humanitarian organization, where she led efforts to empower girls and women around the world. And she put into place these incredible programs that I was witness to with a focus on reducing poverty and really with a strong emphasis on health and development. And then in 2017, she became CEO of the Chicago Community Trust, one of the nation's oldest and largest community foundations. And under her leadership, the trust has adopted a really strong focus on racial and ethnic wealth gaps in Chicago. Now, I just want to say two more things, if you'll allow me, which is, not surprisingly, she is recognized internationally as an expert on health, global development, and humanitarian issues. But this is the testament. She's received 18 honorary degrees, and she holds faculty appointments at the University of Washington and at Emory. And she was named one of Forbes' 100 most powerful women. So it's amazing to have you with us. And if I can start, I thought maybe a way to start the conversation, if you're agreeable, would be if you could tell us a little bit about the Chicago Community Trust, the work it does, because I really would like us to get to thinking about how the COVID pandemic has affected you and the issues that you work on, but maybe as a base to start from, if you could tell us a little bit about the trust.
Great, thanks. And, it is so wonderful to be with you. And as you were going through my bio and thinking about our intertwined lives and careers and all the rest of that, and, how important it is. And I just say that to, kind of this audience, how important it is to have these foundational relationships that you never know when they're going to come back. But there is a bond that comes from people who are in this work and who are thinking about, these incredibly important issues that, some stands the test of time. And even though we haven't seen each other in years, I feel like, it was just yesterday. So I'm just thrilled to be a part of this. So, as you said, I went from doing primarily global work to now being very hyper focused on a local situation and a local context. And, for so many of us who were involved in the global arena, there's a point in which you kind of say, oh my God, my own backyard is, in need of some of the same skills and some of the experiences that I've had. And I think in some ways, 2016, that election, the increased divisiveness of our country really made me feel this urge to do something locally. And so, I got a call that brought me to this role in Chicago, a city that has so much potential, but also has so many challenges. And, I'd never lived in Chicago. It's not my hometown. I grew up in a town that is kind of Midwestern, but not Chicago. Had never lived here. But I really did feel like a lot of what Chicago represents is indicative of what we're seeing throughout the nation. And because I wasn't from Chicago and because I hadn't been doing local, specifically local work, I took some time, better part of a year to step back and think about, how could a community foundation have an impact? And for those who don't know what community foundations do, they're this interesting kind of two-headed organization that is kind of like a private foundation, but also like a nonprofit. And so, community foundations have been around for about 100 plus years. We're one of the oldest. We both have a donor base. So we have people from the Chicago community and even broader who want to invest in Chicago. And then we also, like a private foundation, give out grants to community organizations and others that we think are, really investing and making a difference in the community, in the Chicago community. And when I first came to Chicago, the foundation was pretty classically organized. We had a health portfolio, an arts and culture portfolio, education portfolio, et cetera. And, you could point to 100 plus years of great giving to really great organizations. But, I think we said to ourselves, were we really moving the needle on anything in a way that you could say you could measure impact and you could measure what had actually been done as a result of our funding? And so, we said we wanted to really have a focus, something that's not just a random collection of siloed portfolios. And as we looked at all the issues that were facing Chicago, and they're not different than many cities, we have a huge and sustained issue around violence. We have a health gap. I mean, Chicago has one of the largest health gaps in the nation. We have a gap between education, access, and attainment, et cetera. You could go on down the list. But underneath all of that was the issue of wealth inequality. And wealth inequality that was not just happenstance, but that was, essentially created because of public policies like redlining, lack of access to high quality jobs, et cetera, all the things that particularly Black and brown populations had been left out of. Home ownership, which is what created the middle class in America, access to stable employment that gives you employment benefits. And, you could go on, but a lot of our public policy has actually created what we see today. And so we said, let's attack this issue, which is at the root of so many other issues. Let's figure out how we can make a sustained impact on this issue of closing the racial and ethnic wealth gap, and actually do that both with a combination of where we make our grant dollars, but also how we look at public policies and think about what are some of the long-term systemic solutions that can really make a change on this issue and hopefully be a model, not just for Chicago, but also for the rest of the nation.
Mm-hmm. And so I totally hear you. And then I'm thinking, all right, so you came in and that work is moving full steam ahead, and then there's COVID, right?
And then there's COVID.
Right. So how did COVID then affect the issues that you work on, and how did it change, or did it change in any way the work of the organization in ways that are useful for us to hear?
Yeah, so I think not only COVID, but with COVID around the same time was murders of George Floyd and others, the sense of racial reckoning, this uprising that came as a result of that, where and the absolute clarity of the disproportionate impact that COVID had on communities of color. And I think that was a 1-2 punch in a way that amplified why focusing on these issues were so critical. This is the first time in any of our lifetime, because most of us weren't around in 1919, where we have had such an extreme public health crisis that has also led to an extreme economic crisis. And we saw that the two went hand in hand. And so the very same populations that we were already focusing on were the same populations that were disproportionately impacted by COVID, for the reasons that we know. Who are the essential workers, who are living in multi-generational homes, or crowded home situations, homeless, all the things that allow you not to be able to do what many of us did for 2 years, stay at home, protect ourselves. So we know that, and who has, the diseases that make one more at risk for poor outcomes from COVID. It's the same communities. And then, the corollary economic impact of people who were laid off of jobs, didn't have, job security or job protection, who didn't have childcare, et cetera, that exacerbated the economic situations. So we had this 1-2 punch of a reckoning and acceptance of why systemic racism is an issue in our country, while we were also dealing with a pandemic that really highlighted those issues. So for us, all that to say, having already taken a stance that said we were really going to focus on this issue of racial and ethnic economic inequity, COVID came along and just highlighted why this was so essential. And while nobody wants to have a pandemic to amplify the needs of what you're doing, I think it did exactly that. And I think it really turned not only Chicago as a city and a region around, in terms of thinking that this is not just a nice to have, this is an absolutely essential issue to focus on. I think it opened the eyes of our nation, and maybe even our world, to some of these issues of inequity.
Yeah, 100%, 100%. I mean, one of the things that's really striking is that, what you've done in terms of catalyzing neighborhood investment, and the way that you've done it is something that I think people are talking about and thinking about now in terms of kind of what it means. Can we get granular for a minute? Can you talk a little bit about kind of the strategies that you've employed, right? How have you done this? And I think my question really comes to, like, how specific do you think that, like, what you've done is to Chicago, or are they successes that could work in other places in the US or around the world? That's really where I'm coming from in terms of my question.
Sure. And I wish I could say we have a lot of successes. I mean, we're still early in our journey, but when we developed our strategy, we developed 3 pillars, and they're kind of at the household level, the neighborhood level, and then kind of community level. Household, how do we help to increase household wealth? And that's everything from how do we make sure that people get the education that they need, that prepares them for a career? And I could go on and on about people, all of us who got degrees think that education is the answer. But for many people, education is a further trap, because if you can't afford your education, and if you have to take out so many loans that you both can't pay back your loans and don't get your degree, education is more of a trap than it is a solution. So we've got to figure out ways in which education actually leads to employment, and we think about all the issues that are important. So, one piece of the household wealth is making sure that we have the right kind of career pipeline so that people can have the kinds of incomes that can then be turned into assets. But also, home ownership. Again, home ownership is what created the middle class in America, and it was denied a swath of our population, particularly, encoded into some of the FHA and regulations were these covenants that didn't allow Black people to have mortgages in neighborhoods where mortgages, where their home value appreciated, whatever. So home ownership, big part. Entrepreneurship, how do we, small businesses are the engine of our economy. How do you make sure that people have access to loans, have access to the services, all those sort of things that are critical to being able to create businesses that not only create income, but also give employment streams. So, there's this whole bucket of how do you help people create assets, but also how do you make sure people don't get further into debt? I've talked a bit about student loans, huge issue. There are so many young people of working in poor families who start out an educational path and then drop out, don't have the means to do that, and are further in debt. But predatory lending, people talk about payday lending. I hope most people on this have never had to take out a payday loan. But in Illinois, interest rates were as high as 400% on a loan. So imagine if you're a poor person who already doesn't have credit, and then your only access is to a payday lender who charges you 4% interest on that loan. Well, that's debt compounded debt. We were part of a coalition that was able to put a cap on payday lending so that, these predatory lenders can't continue to create that cycle of debt. So I could talk more about that, but that's our bucket of how do you help to think about at the individual and household level. Then there's the neighborhood investment that you talked about. How do you incentivize private capital to invest in neighborhoods that have been disinvested? It doesn't matter if you own a home. If you own a home in a neighborhood where the value is not commensurate with what you put in. We've got to invest in neighborhoods where there's been massive disinvestment, and there's, all the numbers that show the 5-to-1 ratio of investment in white neighborhoods in Chicago versus Black or brown neighborhoods. And we're working to figure out how do you make sure that there is an incentive to invest in neighborhoods, because there's no mystery. Neighborhoods develop because people invest in them. And so if we can do a better job of really figuring out how to de-risk those investments so there is more, particularly private sector investment, so that there are stores and there are infrastructure and there are, the opportunities, playgrounds and all the things that also increase safety within neighborhoods, neighborhoods will begin to thrive. And then the third pillar is how do we invest in the voices of community and residents themselves? How do we make sure that the narratives reflect the people who are in community, and that people feel like they can engage and that their voices are heard and that they can take actions that really make a difference in their lives? So we're, household, neighborhood, community level, that's how we're thinking about it. And really looking at all those things in terms of how do we invest our dollars, but also how do we invest our voices? One of the things that community foundations can do that private foundations can't is that we can lobby. Private foundations have a restriction on what they can do in advocacy and lobbying. And we've, since I've been here, we've developed a policy and advocacy shop. We've got several people within the organization who are registered as lobbyists, so that we can use our voice to influence policies like earned income tax credit or, child savings bonds and, other things that, are critically important and that the relief efforts that happened during COVID are the kinds of experiments, if you will, that could actually move forward to longer term solutions. Here in Chicago, we're looking at doing a basic income, a guaranteed basic income pilot to really look at giving income support to poor families. And we, from all the research and data, and we did a lot of that in the developing world, where we know that giving people cash and giving people money who are poor is a huge empowering act that makes a huge difference in terms of financial stability. So those are some of the things that we're focused on. And I would just say, because this is all about health, at the end of the day, we all, we know that the social determinants of health, whether you have a job, whether you live in a safe neighborhood, whether you have access to education, whether there's groceries and grocery stores in your neighborhood so you can get high quality food, et cetera, are as important as the things that we think about as traditionally health inputs.
100%. Exactly. And this idea about kind of thinking it is all health, right? It is all health. And I mean, I guess so can I take us down the health rabbit hole just a little bit more deeply then?
Sure.
In terms of a second. And one of the things, again, because I was reading up about the wonderful work y'all are doing, and one of the things is you've been really successful also in encouraging vaccine uptake.
Yes.
And right. I wonder if you could say a little bit about that, and just to just talk a little bit about that. There's been some amazing efforts that have been happening in Los Angeles, and I think we'd really like to learn in terms of kind of how you've been doing it and what's been working in Chicago.
Yeah, and to the extent that we keep trying to make all of what we do really focus on this central theme of how can we deal with the issue of wealth inequality as kind of a framing orientation. Clearly how we get people back to work safe, healthy from COVID is a critical part of that. And we really looked at this issue of vaccine hesitancy and the inequity in vaccine access as a key obstacle to people returning to work, returning to livelihoods, doing all the things that are important for their health, but also for their economic well-being. So, we're engaged in work with the vaccine partnership, the Chicago Vaccine Partnership, to really look at the issues of access, which increasingly are not the drivers. The issues really are much more around people's trust, particularly in communities where there's been long-standing reasons for mistrust. There's been, the rupture in relationships between the health system. There's historical issues. Everybody talks about Tuskegee. I don't know. Today most people don't even necessarily relate to the historical issue of Tuskegee, but they do relate to the fact that they go to a health system and don't get treated with dignity and respect. And I think that so much of this issue of trust and the breach of trust and how people feel in the context of the health care and the health services that they have, or the ability to access health, has really had a huge impact on people's willingness, particularly again from communities of color, to access vaccines, even if all efforts are made to have vaccines available in different communities. So we worked with the health department in the city on access, but then have really drilled down on how do you build that trust, which is so critical, and how do you make sure that the messages are relevant and that the messengers are relevant, and how do you have messages that relate to the lives of people that we're trying to reach, but also how do you make sure that the messengers that bring those messages are the people that they trust, the organizations that have been there, through thick and thin. They're not just the organizations that are here for a vaccine. They're organizations that people trust and who have been with them and their families throughout. And so I just think that issue of how do we use this as a way of not just for this effort, but bridging that trust divide for communities that have had a breach in trust from the health services, the health system. How do we do that? And how do we do that in a way that's longstanding?
Yeah, it makes me think, we both have this strong history in HIV, and I think about kind of, what are the parallels there in terms of kind of what we see in terms of communities and trust, in terms of being able to think about that, but also in terms of kind of governments and how they've been responding or not. And I wonder if you also see these parallels in terms of kind of how it is that both communities are responding, but also and how governments are responding.
Yeah, no, I see it all the time, and I just, maybe because that's, what I got my training, how I got my training wheels. But there are so many parallels. I mean, I think, particularly as we think both nationally and locally, how have we thought about, the issues of access, equity, and I was on National Academy task force that helped to write the national guidelines for the vaccine distribution. And the charge from NIH and CDC was to really develop a framework that was based in equity. So I feel like from the very beginning, these issues of equity were at least part of the dialogue. We didn't do it perfectly, but I think at least we went into this thinking that equity was a key part of it. But then the other piece is, how do we behave globally? And, I think we're still behind the 8 ball in terms of getting vaccines distributed. We have yet to do the kind of effort that I think PEPFAR is still, will go down in the history books as the greatest public health initiative, in that it was not just throwing dollars at something, but it was also how are we building the infrastructure to deliver life-saving medicines. And we have yet to do that for this. I think we've started, but we're so far behind in terms of what we could be doing around global access and recognizing, that in a global pandemic, it's not us versus them. And, unfortunately, I think we have suffered from the politics that were in place when this pandemic took hold. And I think that set us back in terms of our global commitment as well as our national commitment.
Yeah. Sadly, yes. I fully agree with you, right? In terms of just kind of where we are.
Yeah.
And it opens up then for me this question about, all right, so where are there good examples? Like, where are there good examples in the context of COVID? And, are there good examples that you've seen in Chicago or nationally or in other parts of the world where what you see is really governments doing what is needed to try to effectively address COVID and its consequences, including vaccine uptake? Do you have examples to share?
Well, I would, I'm more grounded in what we're doing here. And I do think, we have a public health department that has been consistently, well before COVID, has centered on equity and has always made that front and center. And so when COVID first evolved, and once there was a vaccine, there was a concerted effort to make sure that there were sites that were available in the communities that were most impacted. And the city did kind of a laser focused geographic, where are the neighborhoods that have been most impacted, and how can we deploy resources accordingly, and did this very intensive effort to get into those, into those neighborhoods. It was remarkable. And I was pleased to be able to, on weekends, get out there and go to some of these clinics where they were pop-up. They were clinics in high schools or in recreational centers that weren't used because of COVID or, whatever, but really getting out into communities. And it made a huge difference. And I think, it made a huge difference. Again, it's not just about the access, but it's about the message. It says I'm important. It says my neighborhood is important. It says that it matters that, we are part of this. And so, I think it's that kind of concerted effort. And I don't think it's a mystery. It is saying, looking at an issue like vaccine access and saying, we have, and particularly in the early days, we have a finite resource. Now it's probably not as finite. Who do we make sure gets it first? Do we make sure that the people who have access to computers and can go to a fancy health clinic or whatever, or do we say we're going to use our public resources? Private resources are different, but we're going to use our public resources to get to the communities and the populations that have been most harmed. That's a choice. You can make that choice. You can say we're, quote, neutral and come one, come all, or we can say equity is around how do you get to those who need it most and those who have been most harmed by this or whatever the issue is. And so, it's anyone can make that choice.
Right. And it just takes them making that choice, right?
Right.
So, I mean, I guess, can I pull back? Let me just pull back for a minute and just say, when we reflect on kind of what we've all lived kind of in this last 18, 19 months, however many we are right now, what do you think? Can I just ask, what do you think are some of the most important things that we as a society should take out of this experience? What are the lessons that we need to remember and we need to make sure that our governments remember kind of going forward?
Well, I think the biggest lesson is that this is not the last time. And anybody in public health could have predicted, none of us had the crystal ball. Who would have known that it was COVID? Who would have known that it would have been, 2 years in and it would have evolved the way it evolved. But, we all knew that it was very likely that there would be a biologic, agent that could create a global pandemic. And we weren't prepared. And, I have seen my former agency, the CDC, budget cut repeatedly in between crises. And we would never do that for any other serious threat. I hate to make war and military analogies, but people would think you were crazy to say, well, we'll just take money from the military until there's a military threat. We don't do that. We fund the military. We make sure that there is readiness. We make sure that troops on a minute's notice are able to go wherever. And therefore, we continue to be well prepared militarily. We need to be well prepared from a public health standpoint. We should not cut public health workforce in between threats. We should not let our laboratory systems, get behind latest technology. We should not let our data systems and our surveillance systems not be kept up to speed. So to me, the biggest message in this is, how do we make sure that we are prepared for whatever the next biologic threat is? And who cares if in between times, if it's 10 years, if it's 15 years, whatever, let's not ever go through this again. And I think it's, there's, how do we make sure we have the systems in place? How do we make sure we have the coordination in place? How do we make sure that we've got, all the things that would have allowed us to be much more prepared for this than we were? That's on the public health side. On the, kind of on the social and economic side, we will be digging out of this economic hole for a long time. You know, it's been extraordinary to see the markets come back, to see, you know, how industries have come back, what have you. But where I sit, people who were harmed by this are not bouncing back, and communities that were hurt are not bouncing back. We would be in so much of a better position from our total economy if we thought about economic resilience in the same way that we think about, you know, broader resilience and preparedness. You know, we could be much better in shoring up, you know, economic stability for our poorest citizens, so that every time a crisis occurs, we don't have to do emergency relief bills. You know, people already have childcare and paid leave, and, you know, bills, money to pay their bills, and rent forgiveness. You know, all these things that we saw on a emergency basis. We should be doing many of those things just to make sure that people who are financially, you know, fragile have some ability to bounce back, and that we don't have to then pass $1 trillion bills to shore things up, you know, when they occur. So I just think that preparedness, to me, and, you know, anybody who's ever been in public health, we know that people are willing to spend trillions of dollars for diseases once they occur, but nobody is willing to create the conditions by which those diseases don't occur to begin with. And I just think we should, you know, think more on the lines of prevention.
I was just gonna say, you're talking prevention, right? So yeah, exactly. Right. No, and I'm totally with you. A couple of things, just audience people, please put your questions in the chat. I've got a couple. I'd be happy to take a couple more. But before opening it to some of these questions, I have kind of two more specific questions I wanted to ask. So I guess my first is that when we think about the policies around the world, in Chicago, in the US, but also around the world, that have really come in to focus through COVID, and just thinking about the ways in which police powers have been used, the ways in which a whole lot has happened in this last period. Are there areas of focus? Are there policies that you're aware of that you're now more concerned about than you were? Things that have to do with how we function as a society?
Yes, there are lots of them, and I'm learning every day. So, you know, as an example, I don't know if you've heard or read the book that Dorothy Brown, who's a law professor at Emory, wrote about the tax code, and how the tax code, which all of us think of, you know, many of us are irritated by the tax code, but we think about it from the standpoint of rich people getting off or whatever. But she writes a book about how the tax code really is also racially biased, and how the way in which, as an example, families where you know, a Black family is more likely to need to have two working adults, where the tax code, which was written back in, you know, whenever, was more likely to have a man who works, a wife who stays home. So if you're filing as a married couple and you have a stay-at-home wife, which was the tradition back, you know, whatever, when the tax code was written, that wife brings down your tax liability, and you pay less taxes than a Black family who traditionally had to have two working people and paid actually more taxes, even though they were, relatively speaking, poor. You know, it's just an example of how we think about things as being race neutral. And in fact, there are things that, you know, I don't think that people set up a tax code and said, well, we want to make sure that, Black people pay, relatively speaking, more taxes than white people. But there are things that were not thought about that are not race neutral because we're not a race neutral society. And so, for me, it's been very interesting to look back and recognize, the ways in which we as a country, and then that gets into all these things that become controversial about talking about these issues that, we see people are legislating against talking about things that they call critical race theory, but are just the history of America. But I think it's examining our history and looking at what are the ways in which advertently or inadvertently we created a system that is inherently unequal and disadvantages groups of people because they weren't at the table or they weren't thought about or their needs weren't thought about. And so, that's for me been the most interesting part of, I almost feel like I was Rip Van Winkle. I was doing all this global stuff, and then all of a sudden I'm parachuted back in America, and I'm like, oh yeah, this is how we are where we are. And, it's just fascinating to think about, how do we, in a way that is fair to everybody, look at how we unravel some of these issues that, by almost their foundation were created in a way that stacked the playing field in one direction versus another.
I totally hear you. And I'm gonna jump from my last question to a question that's come in on the chat because it fits perfectly with what you just said, I think, which is whether you could speak a bit about bringing your global experience and expertise to your work in Chicago. What did you feel in terms of what can more systematically be learned from other parts of the world, and how might we better situate US public health within global health?
Yeah, I think people ask me that all the time. And one of the things that I just think that we do so much better globally than we do here is that we listen to community. When we go to another country, and if you're somebody not from that country, you don't presume you have the answers. You listen. You think about elevating their voice. And I think here we kind of obscure differences, don't want to talk about them, and then therefore we don't really listen intently on the needs of communities. So one, I think it's just that deep listening. How do you actually learn from communities? Because when I was doing more global health, I mean, one of the things we said all the time is that community has wisdom. We might have certain skills and techniques, but communities actually have the answers to their own problems. I don't think we do as good a job here in doing that as we do globally. I think the other thing that I feel we do probably better globally than domestically is looking at partnerships, and particularly cross-sector partnerships. So, I think about a lot of the work that we did at CARE. We worked so closely with some of the private sector companies that were multinational companies that understood, again, this notion that we're on somebody else's turf. Therefore, we've got to think about how do we work in partnership. And I think we can do a better job of thinking about, not this deep divide. Here's the private sector, here's the public sector, here's the nonprofits, and nonprofits are good and privates are bad and government's just a pain in the neck. How do we just, figure out how we, do some of that better? And so I think, and then I just think there are ways in which, I think about all the ways in which work in places in Africa where technology by definition had to leapfrog. And we did, things like mobile payments. We were doing mobile payments in Kenya long before we were doing mobile payments here, because, in resource poor settings, people had to think about how do you leapfrog to the next generation, because there wasn't time to put telephone wires, cables throughout countries. People just went to mobile long before we were thinking about that. So I just think there's also innovations. I think about all the point of care diagnostics that we developed in Africa and in Asia because there weren't labs to go to. So, we had technologies, or at least beginning to think about technologies that were good for resource poor settings that we could be using here. But because we have, big laboratories, we don't think about how do you take that to people here. And so, I think, again, COVID with all the home testing and all that sort of stuff is a good example of how, things like that we thought about a lot more in resource poor settings that we're now thinking about how do you bring some of those innovations here. So, I just think there's a lot of innovation, technological innovation that can occur when you are resource constrained and you have to think about, how do you put to use things in a more creative way.
And I also come back to kind of what you said before about listening to communities. You also, when you were talking about what your organization now does, you were talking about listening to communities. So you are taking those lessons in ways that seem super, right? Like very important. All right. I have a couple of little love notes to you, just that you're fabulous, that I want you to hear, but I'm not going to read those, but I have a question here, which is, how do we, as a predominantly white audience, privileged professionals, start to practically address the issues of race that have been so exposed during this pandemic? A lot of what we're all talking about is in the realm of policy, but at the level of the individual, what can we do practically to address this in our day-to-day lives and practices? Is it just about being better informed, or is there anything that you would suggest to guide us?
Yeah, I mean, I think one is being better informed. I think information is always kind of the foundational bedrock. But I also think it means, going outside of people's comfort zone a bit and, coming into community with people who, may not look like you, may not have the same life experiences, but, in many ways are very much like you. There's this wonderful woman who's a photojournalist who has created this project called the Folded Map. And Chicago is a they say they're a perfect grid. I don't know, perfect grid, but you have an address on the north side that is the same address on the south side. So 5700 north, and there's 5700 south Halsted, or whatever. And what she literally did was basically fold the map and started introducing people to their neighborhood analogs on the different side of the city. North side is the kind of traditionally white, privileged. South side, Black, poor neighborhoods. And, when you see people coming together who, for the first time, see, oh my God, this person is wonderful, great human being. Their home, would sell for $500,000. Same home, basically same architecture, whatever. That same home would sell for $75,000 on the south side. They start realizing, there's something not right with this, and they start forming that bond. So I think one of the biggest things people can do is to get outside of their comfort zone. How many people socialize with people who are not like them? I mean, we all feel more comfortable socializing with people who, we have things in common, but trying getting outside of that. And, and I think the third, so, one is the information. Two, how do you think about going places and being in community with people who are different in some ways and express different things, and really listening to understand what the commonalities are. Because I think one of the things that people find is that at the end of the day, all of us are pretty similar. We just have very different circumstances. And if I was in the circumstance of person X, Y, or Z, I might do the same thing that they did, because based on the opportunities and the options they had, they made very realistic choices. And we often think, well, why did they do that? But that's without thinking about what were the options that they had, what was set of circumstances. And I think 3 is being willing to not always have to hear your own voice in a conversation, and being able to allow somebody else to give voice to their experience, even when you're the one who's used to being the most dominant voice in a conversation. And that, I think we all have challenges with that, but it's like, when I'm able to step back and not say anything, what I learn, and then what others learn as a result of hearing different voices, is extraordinary. So, and then there's all kind of other things like getting involved in organizations that are doing things but I just think those fundamental things of, being better informed, stretching outside of your comfort zone, and then being really willing to let other voices be heard is critical.
And I love your map story. I didn't know about that. I think that's awesome. I mean, that's a really interesting thing. All right. So
and by the way, I mean, she's been featured on ABC News. Just do Folded Map. You'll see it. It's an incredible project.
Sounds amazing. I will. I will. I hope others will as well, right? Because I totally will. So in terms of my last question, really, is, there's a lot of students that are attending today. And so can I take you back to the personal then, right? So when you look back and you think about where you were in your early 20s and how your career has developed, what's the kind of advice you wish someone had given you? What advice do you want to give people now who want to work at the intersection of public health and social justice? What do you say?
Like so many people, you can look at your career and explain it, and it sounds very logical. At the time, it was just going with what I thought my sense of purpose was, and being willing to take a few risks. I went from the safety of CDC that had been my home for a couple of decades, and moved to the Gates Foundation that was new at the time, and then moved from public health into global development. All of those moves were scary at the time. It's like, I'm leaping into something unknown. But I think it's when you're willing to take some risk, but understanding what truly motivates you. I don't think there's any one way to take this journey. I think it's really very individual. I think it's very based on the things that really do motivate you, who you are, how you work, who you want to be surrounded by. So I just think being willing to be open to opportunities as they come along.
That makes perfect sense, right? And so it is one of those things in terms of just bridging the public health and the justice frame. It's kind of where everybody's coming from, right? It seems what it's so important, and what's happened right now with COVID is everybody. And one of the things that's really empowering and amazing about working with students in this moment is just the sense of urgency that students are feeling in terms of wanting to do right in terms of this and going forward. So I thank you for that. I know that I promised you to try to get you out before, like in the next 2 minutes. There's one question. There's one persistent question here. So if I can ask it really quickly, and then we can close from there. The question is, given that trust between communities and authorities, health, public safety, security, economics, is foundational to success in those areas, how do we rebuild and invest in that trust?
Yeah, I think trust is at a community level is no different than trust at an individual level. if you breach trust with a close friend because you in some ways did something that made them feel like you didn't have their best interest in mind, you spend the time to show that person that you are worthy of their trust. And I think it's it's the spending of time. I think people want trust to be built in a nanosecond. People around this vaccine moment, it's like, doesn't the community understand we've got this life-saving thing and people aren't coming to get it? Why don't they trust us? Well, because there's decades and decades of reasons why trust has been misplaced. So I just think it's like anything else. You start, from the beginning, and you start building and you start showing that you're trustworthy, and you do things. And, as sad as it may be right now that there are communities that even to this day don't trust the vaccine. I don't think that we should be disheartened by that. I think it should be a call to how do we start now to change how we treat communities? How do we treat people who come into our systems with dignity? How do we think? I'll slightly digress, but somebody sent me an article not too long ago that was talking about, I'm forgetting exactly, but it was outcomes of Black patients versus white patients. And it was all about how people were treated and how that, translated into actual medical outcomes because of this, issue. I could have written that article 30 years ago. It was the same thing we were talking about as medical students. Do you call somebody Sally versus Mrs. Jones? The white patient gets called Mrs. Jones, the Black person gets called Sally. How are we, you describe people by their demographics even when you don't need to. There are things that we do that are these small but significant ways that make people feel a sense of dignity or a sense of lack of dignity. We've just got to start, investigating that and building that sense of trust. So trust with communities it gets built just like any other trust. We all have experiences in our own personal life where we have let somebody down. I think that's just the same process that it goes through, that we've got to think about, how do we build trust? How do we make people feel respected? And how do we make sure that we're also thinking about the barriers that lead people to feel like they are not valued? So it's all about, human dignity and value.
Right.
And the ways that we can do that. So
as it always is, right? As it
yep.
always goes.
Yeah.
Yeah, totally. You've been amazing. Thank you. Thank you. Thank you for your substantive engagement. Thank you for everything that you do. Thank you for taking the time. And really just thank you for the depth of your responses. It's really, really important and just really wonderful that what you've done. I just hope that we can stay connected. I hope you will come to visit again sometime, in some way. And also just to all of you, thank you everybody for being here.